The father in this photo is confused. There's psychosis going on, hallucinations, severe muscle aches, but the family does not know what's going on with this. It's before the year 1813, before they discovered what delirium tremens is. However, the wife could assume that alcohol did play a part in this, considering he hadn't drank in over 48 hours. Now let's jump in and fast forward to past the year 1813 and discuss symptoms and treatments and preventatives of delirium tremens. So 1813, first off, sorry everyone, my big head's always in the way. That's what this bad lighting is. And I'm still working on the whole board not being reversed, but let's go ahead and jump into it. So delirium tremens. So before the year 1813 is stated, it was not there was no diagnosis for it. However, I do still think through some of the research I've done, for example, let's say somebody was suffering from psychosis, hallucinations, severe muscle rigidity, tension, things like this, and severe agitation and confusion, I would still say that even though it wasn't a diagnosis, not yet at least, there's still a lot of reason to infer that if somebody was going through this and there was family, they definitely had an idea of what was causing it, especially if they were drinking very heavy. And we're not going to go into the amounts that would dictate what DTs would be. It would just be moderate to heavy use. If you pulled that away abruptly, cold turkey, I think people could infer that that was probably, even though they didn't have the name for it, that that's what was causing this. But that's one reason why even 100 plus years ago, actually, again, they tried to actually not make alcohol where it's like a prescription only, but make it to where you could only drink limited amounts in the States. Now, first off, delirium tremens. So let's start with what is it again? So what is it? It's the most severe form of alcohol withdrawal. Once again, as I said, moderate to severe, and also delirium tremens, we can refer to it as DTs, okay? So moderate to severe use, we're not gonna go into those numbers, but you know if you're drinking heavy or not. If you're drinking liquor compared to beer, obviously, alcohol content's a lot higher. So yes, you would have a higher chance of lower amounts of that compared to like an average beer size, having DTs. Also sake, which is in Japan, is even hot, people drink that in insane amounts of that, and it has higher alcohol content. So in Japan, DTs are actually, surprisingly, they actually recently have had higher percentages of DTs as well due to the amount of alcohol and stuff a lot of times in Asian culture that they drink. Now there are genetic differences as well with that, but that's off subject. So moderate to severe drinking, also extremely common if someone stops drinking abruptly, as I said, so that would be right here, cold turkey, which will go into why you should taper. Sorry again for my big head being in the way, but why you should taper as well. Also with what is DTs, I really just want to say this too. To summarize it, it is severe nervous system changes. Just keep that in mind right now. So when you have severe nervous system changes, in particular, it's affecting your CNS system. So heavy use of alcohol, which another word for that right here is ETOH. That's just another way, ETOH use. It kind of sets up a game, how can I say this, of tug of war. It's a tug of war like effect, and essentially over time with this tug of war effect, picture your CNS system, your central nervous system, and alcohol. When you're drinking day in and day out, your central nervous system is going to start adjusting to this, because what alcohol does is it's a downer. It makes it to where you have a lower, as stated right here, lower respiratory rate and lower heart rate, which once again the central nervous system controls your breath rate and heart rate. So if you stop drinking abruptly, essentially with the tug war, essentially it is if you pull back the alcohol you've been drinking, which once again, decreasing heart rate, decreasing respiratory rate, it's also decreasing your reflexes as well. If you pull that abruptly, that essentially that alcohol, or let's just say that stimulus, if you pull that really quickly, your central nervous system does not have enough time to compensate. It can't adjust that quickly if you just pull, if you're drinking a lot of alcohol, to where if you pull it, your central nervous system, what will happen is it can't adjust. Your responses and perception is going to be increased. So your heart rate, everything's going to be a lot higher. In particular, your stimulus around you, just like, for example, for you and me, seeing things around us normal, if somebody is in DTs or going to go through DTs, things such as TV, stimulus in front of them, it's way too much. It really affects their central nervous system to where everything feels like, it feels spinny, dizzy, you can start hallucinating, things like that. So that's why it kind of has that tug of war effect, because alcohol, once again, it's a depressant. It slows everything down. If you pull that abruptly, once again, if you pull the alcohol abruptly, your central nervous system, which everyone obviously has a central nervous system, hope everyone should know that, your CNS, you pull that abruptly, that alcohol, that stimulus, it just can't, it can't compensate quickly. It will eventually, but it takes a lot of time. It just takes a lot of time, meaning even up to like 3 to 5 days to get past that stage of the potentials for DTs. So that's why it's kind of called that tug of war effect. Now, also with that, I wanted to mention, so just to summarize real quick with this too, since it can adjust quickly, since your CNS system can't adjust quickly, if you pull alcohol that quickly, your CNS system is going to go through hyperactivity. It's going to be you're going to have hyperactive responses, and I just wanted to let everyone know this. It's typically, when this would potentially happen, it'd be 48 to 96 hours after last drink. So that's something you need to know. So it's a change in your central nervous system. That's kind of the gist of it. Now let's real quick go into the symptoms now of DTs. First, and real quick too, again, this is why there is an importance of tapering off of alcohol sometimes, as opposed to just pulling it all at once. Now there's situations where you have no choice, where you should cold turkey and they'll put you on a benzo. But if you're at home and you're drinking a lot and you've tried in the past and you could have potentially, even if you have like even a chance of like seizures as well, you should considering trying to taper it. So symptoms for DTs or delirium tremens: agitation. And these are the ones that the ones I listed are the ones I've seen most in the psychiatric setting, from working with psychiatrists directly as an RN in regards to, and I've seen this on detox units a lot. This is something that happens fairly often, and it can be scary. It is severe. It is a very severe detox that can lead to life-threatening consequences. So agitation is a common symptom. Body tremors, changes in mental function, sudden severe confusion, and with, once again, sudden severe confusion, which also can lead to some forms of psychosis, in particular visual or auditory hallucinations, the general idea of fear, extreme anxiety, restlessness, and then here's the kicker. If you ask about sleep, it can cause insomnia, or you can be in a very, very deep sleep to where it's hard to arouse you. That can be a sign of DT. So you can be sleeping to the point of where you're not getting up for 24 hours, or you're not sleeping at all. Now, one of the most common symptoms out of all these narrowed down is the visual hallucinations. Bugs on the wall, seeing things, seeing family members who aren't there. Sometimes there was a patient one time who was in DTs, which we had to send him out, who kept thinking his wife was there at the psychiatric hospital with him when she unfortunately had passed years ago. So the visual and auditory hallucinations are a very, very real thing. And lastly, as well with symptoms, I write seizures. Seizures, they are common with DTs, but a lot of times from what I've seen, seizures can also be a precursor to DTs. So if somebody has a seizure disorder, or you've had a history of having DTs in the past or having seizures as a result of using alcohol, you have a higher chance of potentially developing delirium tremens as well. So keep that in mind. Also, like and subscribe at this point if you haven't. Leave a comment too. Back to it now. So for the treatment, what I'm going to say is with this first, before I go into treatment, the best treatment is prevention. It's recognizing it to where they can get treatment as early as possible. Now, in the psychiatric setting, that's why a lot of times if we think they're in DTs, we just send them out to the hospital, because a lot of the private psych hospitals, a lot of times, they're not connected directly to the main hospital. A lot of times in psych hospitals, if they have a detox unit, you can't give bags of fluids, et cetera, due to like having potentially suicidal patients as well, suicidal ideation. So we'd have to send them out, call EVS and whatnot. Now, for treatment, and this can apply at home, a couple of these at home if you're detoxing, or if a family member, if you have somebody who could potentially be detoxing off of alcohol soon. The best things you can do is, remember, always recognize, it's not to scare you, that it is life-threatening. Another thing is, for the person going through alcohol withdrawal, having a nice well-lit room, and with this goes reducing the stimulus around the patient. And you might go, wait, well-lit room, stimulus? A well-lit room, because during the day in particular, because if you keep it dark and they're potentially going to go into DTs, seeing things on the wall, shadow people are big, seeing shadow people is big as well. So that can sometimes, if they start hallucinating or have a precursor to hallucinating, that can only make it worse because it causes more anxiety. They can become more agitated, psychosis, et cetera, et cetera. Also with it, now if you're in the psych hospital or whatnot, or you have to get treatment, medication-wise, benzos and Librium. At home again too, if you are considering going off of alcohol, tapering to avoid them, especially if you have a history of seizures or a lot of health conditions, heart conditions, if you've had concussions, because of encephalopathy as well can happen, which is essentially from DTs, which is brain swelling. But hydration, and this goes if you're going to detox really off of anything in general, trying to be hydrated, especially if you haven't started the detox yet and you don't know if you'll be able to hold anything down. Hydration, Powerade, Gatorade, water, because a lot of times somebody going through alcohol withdrawal, they're going to be depleted on a lot of their electrolytes, and this is just an easy way to get some in as well. Remember, once again, with the treatment, preventing, so if you're going to start the detox first, staying on top of those detox symptoms, because DTs is the most severe type of withdrawal in regards to detoxing off of alcohol, to where you want to try to combat this by really attacking the early stages of alcohol withdrawal so you don't go into delirium tremens or DTs. As I said, if you're in DTs, benzos, Librium, however, in their own right, benzos act the same as alcohol, even though it's a treatment. You wouldn't want to take benzos long term because that could cause seizures in itself. I already said electrolyte therapy. So there are some things that you can, especially if you haven't started the detox yet and you're thinking about going through the detox of alcohol, things such as tapering off, always trying to talk to the healthcare provider if you can, but if you can't, trying to taper off the alcohol slowly and then pushing it away so you avoid that tug-of-war response. Also, trying to get your electrolytes in, things like that. And also, in particular, thiamine, which you can buy over the counter as well, is huge, especially if you have a history of seizures. And somebody going through alcohol, drinking, if you're a heavy user, there's a high chance you have a lower level of thiamine in your body in general, which that's something they will give in the psych setting a lot regardless, is thiamine or vitamin B1, as well as a multivitamin. But thiamine, because the big thing is, especially if somebody is going in to DTs, brain swelling, encephalopathy, which I can't really say, that's the problem with it, is it can cause brain swelling, which can cause you to go into a coma. So thiamine is something you should definitely pick up. And also with thiamine, it can also help a lot. One of the biggest things is it can help with muscle coordination and confusion. And these can be, once again, this isn't something you would wait till you have delirium tremens, or if you're helping somebody who could potentially go through, you'd want to be giving this to them as early as possible if you know they're going to be going off of alcohol and they're going to start detoxing, to avoid things such as DTs and things such as seizures and whatnot, because once again, your nervous system, it plays a vital role in so many functions throughout your body that if that gets out of whack and it stays out of whack for long amounts of time, things such as brain swelling, long-term problems with muscle coordination, even things such as they're not being paralyzed, but your spinal nerves not working the way they used to where, you know, your coordination's messed up after you come out of the DTs. But more importantly, it can lead to death, unfortunately. So I hope this helps someone out there. This was symptoms, treatments, and also, as related to it, delirium tremens is not something it's not something you can say for other types of withdrawal. However, delirium tremens, from the psychosis aspect, I think it can be applied to especially other downers such as benzos and even uppers as well, because psychosis, if you're not sleeping well, lack of sleep can lead to coordination issues, which can lead to problems with your with just nerve control in general. So a lot of these treatments go hand in hand with a lot of different types of detoxes. But like and subscribe, leave a comment. I know I haven't gotten this video out. I didn't get it out for a while. I wanted to throw it out now. I know my board's a mess. I know I have a big head. Yeah, leave a comment. We'll have a new video out soon. I don't know what it'll be yet, but it's anything mental health related. Check out my 365 days of running 4 miles. I'm going to put out a video like every 3 to 4 days of a short of that. But yeah, get it. You know what I mean by that. Get help if you need help. There's always, it doesn't matter where you're standing. If you're breathing right now, you can improve your life in some way. But once again, have a great weekend coming up, and I hope this helps someone in some way.